Or maybe it wasn't. I might have missed it.
Okay, what do we have here? Look, this is what we saw earlier also. The heart, all the blood vessels, the coronaries, and this and that, and then what is this here? Superior vena cava, brachiocephalic, right? This is the jugular, subclavian, jugular, subclavian, right? In the midterm exam, now that will be your next exam, what do we ask? 95% of the questions will be all about name, this, that. So I will have my pins here, over here, there, everywhere, all these places. All you have to do is just name them. In different models, the things, they might look a little bit different than the other. Okay, so I would request you to make sure that you go over all these models so you can recognize them. This is the inferior vena cava. These are the renal arteries and veins, right? This first blood vessel which comes out of this aorta is what? Celiac artery. If you have your lecture book or something, you can open that too. It looks exactly like this. This is a celiac artery or celiac trunk. Remember we saw. Okay. If I put my pin right here, I'm not asking about aorta, because I can ask about aorta right here too. Why would I put it exactly like this? Because I want to know this particular branch, that's why. So sometime I notice when I have my pin here or somewhere, and people say aorta, 0, 0, 0, 0, 0, 0. That's all they get. If you want to get a point, you have to name these particular vessels where my pin is. So this is celiac trunk. This one is superior mesenteric. This one is inferior mesenteric. There are a couple of blood vessels which are missing here. These right here on the sides, they are iliolumbar.
What is it?
Iliolumbar. This one right here is the femoral. Okay, this is common iliac. Then it branches internal iliac, and this one is external iliac. This is common iliac and common iliac, right? Aorta divides into two. Each is called common iliac. Now, this common iliac will divide again into two. Internal iliac and external iliac. Artery and the vein, same thing. The moment it divides into two, now the same blood vessel which was called common iliac will now be called external iliac. So this is external. That one going inside is internal iliac. When this blood vessel crosses this is called the inguinal ligament. When it crosses this ligament, the same blood vessel will be called the femoral artery. So this is the femoral artery. This is the femoral vein. There is a vein which is coming out and becoming more superficial. This is different. This is called great saphenous vein. So there is a difference between this one and this one. This is femoral vein. This is great saphenous vein. Okay. Clear? All of these names are written in your lab books, and you have beautiful pictures in your lecture books. Okay, so great saphenous vein and femoral vein, and this is femoral artery. This one right here is external iliac artery. This one is common iliac artery. This is, and this one is inferior mesenteric. Same thing you can see over here also in this. Same exact stuff over here, pretty much. There would be a couple of things which are a little different up and down. For example, in this one, you can see one additional thing right here. These two little ones, other than this also. This is inferior mesenteric, superior mesenteric. This is celiac trunk. It looks a little bit different here. And these two little ones are gonadal arteries. Gonadal, testicular or ovarian arteries. You don't see in the other model. So that is why I was saying in every model there might be a little bit of a difference. Over here again femoral and external iliac and all of that stuff. Same thing over here. One extra thing here in this model you can see, not in the other one. This is carotid, right? This carotid divides into two. One is on the outside. This is called the external carotid. The one which is going towards the inside will be called internal carotid. So you want to know the difference between the two. The external then gives out further branches. This one is called facial, and then this is temporal. Okay, over here in the liver, you can see some blood vessels too. This is inferior vena cava, we learned already, remember? Inferior vena cava. This one right here was what? We did all of this stuff already in our GIT. What was this here? Portal vein. Portal vein. This was the bile duct. The green one was bile duct. This was portal vein. This was the hepatic artery. So you need to know all of this too. This is stuff which we have already done. I didn't ask you guys, but this is exactly what I asked in the quiz from now. Let me sort of make sure you know this. Same thing over here. Okay, right here. Now this is something which just shows you the arm. This blood vessel right here is called, before it enters the arm, it is called the axillary artery and axillary vein, right? And then this axillary artery enters the arm, so over here we call it brachial artery. When it reaches the forearm, the one which is towards the thumb is called, this red is the artery, right? This is called radial. The one which is on the pinky side is called ulnar. So this is ulnar, this is radial, this is brachial, right? This right here, and this is axillary. Same could be true for the vein also. This is the axillary vein, the big one, then it keeps on coming and becomes the brachial, and then it will have some extensions coming out. There is one which goes right next to the ulnar artery is the ulnar vein. The one which goes next to the radial artery would be the radial vein. But these big ones which you see here, the more superficial ones, they have different names. This one right here is cephalic vein. Cephalic vein. This one right here is basilic vein. And then there is one which connects this one and this one, that is this right here. It is called the median cubital vein. So you want to know some of these superficial veins also. The cephalic here, basilic here, and median cubital vein. These three in this model also, which are other than the radial, ulnar, and all of those other same as the arteries. Most of the places, the arteries and the veins, they are the same, but sometimes they have different names too. Okay, so this is one of the examples where we have different superficial veins. Okay, let's see here. Sometimes we use all these different models because I cannot have the names are the same, but we will need a lot of models to ask questions. I can ask only 2-3 questions on one model. So, what is this one? What is this right here? This would be axillary, okay. And when it comes right here in the arm, it will become brachial. When it goes to the forearm, see, it divides right here. One stays on this side, this is radial, and this one would be ulnar. Okay, this one right here is
femoral.
This is common iliac. This is common iliac. Then it divides into two. This one would be external iliac. This is the internal iliac.